The Role of Informatics in Decreasing Healthcare Disparities by Amber Pruitt, Tanya Hoffman, Elizabeth Berry, and Maureen Fawcett. What is healthcare disparities? Healthcare disparities are the differences in treatment of a disease process, quality, access, outcome of healthcare within a specific race, ethnicity, or a socioeconomic group. Some contributing factors of healthcare disparities are underserved communities, economic challenges, individuals with disabilities, personal behaviors, culture, education, language barriers, race, ethnic groups, age, and gender. Some examples of IT technologies for the healthcare provider that can improve some healthcare disparities include the electronic health record, or EHR, which is a digital version of patient data found in traditional paper records, increasingly used to refer to a longitudinal record, ideally of all healthcare encounters. Computerized physician order entry, or CPOE. It's the process by which the physician or another healthcare provider directly enters orders for client care into a hospital information system. E-scribing. It's the electronic transmission of drug prescriptions from a hospital-based inpatient ordering system or handheld device. And telehealth, which is the use of telecommunications technologies and electronic information to exchange healthcare information and to provide and support services such as long-distance clinical healthcare to clients. Some examples of IT technology for the consumer are personal health record, or the PHR. It's a lifelong tool for managing health information such as disease conditions, allergies, medications, past surgeries, and other relevant information. We also have Consumer Health Informatics, or CHI. It's the study of patient use of online information and communication to improve health outcomes and decisions. And we have social media, which are web-based programs and technologies that allow consumers to interact socially with others online. What is informatics? Informatics is the study of the structure, behavior, and interactions of natural and engineered computational systems. What is informatics? The science of processing data for storage and retrieval. Data, people, system equals informatics. Some areas of informatics can include biology, business, computer technology information, computer science, health science, human-computer interaction, legal informatics, and media arts and science. How can informatics be useful in healthcare? The way treatments are defined, selected, and evolved. EHR, EMR, emergency department. Allows new technologies to be utilized in order to work smarter and faster. Provides future directions. Laboratories. Research. Manages and communicates information. Nursing. Supports education. Provides online services for healthcare professionals. Radiology. Cost reductions. Provides the opportunity and power to connect technology and people. Promotes knowledge and wisdom, admitting, and enhances productivity and efficiency. How does informatics help the healthcare provider in decreasing healthcare disparities? Electronic medical records, or EMR. Handwritten medical records can have gaps of information since they are episode-oriented. The provider may potentially fill in gaps with his own clinical beliefs about certain population. The EMR offers more complete patient information, lessening opportunity to introduce biases. The EMR has the ability to track treatment trends over time and such that the provider can note if he is meeting standards for all patients. Any noted healthcare disparities offer opportunity for the provider to improve care for those patients. Telemedicine, which are appointments with provider via teleconference. Consumers who live in underserved areas may have access to care not otherwise available. It's more cost and time efficient, which further engages consumers in their health care. It allows consumers access to centers which may have more expertise in a particular disease process. How does informatics help the healthcare provider in decreasing healthcare disparities? Computerized physician order entry, or CPOE, and electronic prescribing, e-prescribing. This decreases potential for medication errors and creates opportunities for increased consumer trust in the healthcare system, which can be lacking in minority groups. Quicker medication fill and refill times promote consumers' sense that his time is valued and may lend to compliance in getting future prescriptions filled. Social media. Minority populations can be less engaged in their healthcare due to mistrust in the healthcare system. Online patient support communities enable consumers to participate in healthcare information exchange. Online information searches allows the consumer to ask the provider more informed questions. Minorities are bigger users of cell phones and use more cell phone data functions. Providers can take advantage of this through healthcare educational posts to YouTube and Twitter and the creation of cell phone apps. Online free translation services allows non-English speakers to search online for information in native languages. The role of informatics in decreasing healthcare disparities and the Patient Protection and the Affordable Care Act, ACA. On March 23, 2010, President Barack Obama signed the Affordable Care Act, or ACA. The ACA was implemented in order to decrease disparities in healthcare and to promote high-quality healthcare in America. The ACA is a reform aimed at attempting to decrease healthcare disparities many Americans are faced with today. There's been much controversy regarding the healthcare mandate. America, land of the free, promotes independence amongst people. Many Americans feel the Affordable Care Act violates the First Amendment. The First Amendment grants Americans freedom of speech and religion. There is hope toward a new America. Assuming that all eligible Americans participate in the Affordable Care Act, there would be a reduction in the amount of ER visits. Americans will have routine doctor's visits and medical screenings due to the fact that they have health insurance. The ACA's goal is to promote health and well-being. Emergency departments will be utilized for true emergency visits, therefore reducing the overall healthcare costs and hospital admissions. Barriers which lead to healthcare disparities include, but are not limited to, the following: socioeconomic, environmental, social, physical, and psychological. Therefore, as nurses, we must screen clients on an individualized basis in order to identify clients who face disparities within the healthcare system. What is the ultimate goal of informatics? The goal of informatics is health equity. Healthy People 2020 defines health equity as attainment of the highest level of health for all people. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. I hope you have enjoyed our presentation. Thank you.